Good morning on this Wednesday. I'm Brendan Kinney with UpNorthLive News, here with another edition of your Mental Health Connection, joined by these fine people we'll introduce here in just a moment here. They're community health professionals, mental health professionals, and they're with Northern Lakes Community Mental Health. This morning, we are talking about the brand new Grand Traverse Mental Health Crisis and Access Center. We'll get you all the information you need in just a few moments, but ladies first, we'll start in the upper right-hand corner. Good morning to you. Thanks for joining us. What do you want people to know about you?
Good morning. My name is Clarissa McEwen. I'm a certified peer support specialist working crisis. I've been in Northern Lakes for 3 years. My job entails is to help the community, provide resources, and connect people with services.
All right, Risa, thank you for joining us this morning. And Hunter, we'll go to you next. Good morning.
Yeah, my name is Hunter Lumsden. I'm a crisis clinical therapist and limited licensed master's level social worker. I was hired onto Northern Lakes in August. I just graduated with my master's degree this summer, and I'm really excited to be a part of this project.
And Michael's been with us in the past. For those who weren't watching a few months ago, Michael, what should we know about you?
Hi, everybody. My name is Michael Corby. My title is the Behavioral Health Director over the Crisis Center. I've been with Northern Lakes for roughly 10 months and have just been working with our team like Hunter and Risa to get this Crisis Center up and running.
Good deal. And for those of you watching here on the UpNorthLive Facebook, YouTube, and X, we are based here in Northern Michigan. We'll talk about where you can get services with Northern Lakes Community Mental Health here in just a few minutes. But first, Michael, we'll start with you. If you can talk about what's happening with this new Grand Traverse Mental Health Crisis and Access Center.
Yeah, thank you. So it's been years of discussion and planning between Munson, Northern Lakes, and other community partners, and we're finally set to open the doors to this brand new crisis center. And we're here to address gaps in services for those in mental health crises. So the center's name has gone through several iterations, but the official name, like you said, Brendan, is the Grand Traverse Mental Health Crisis and Access Center. It's going to include several services within, such as walk-in and mobile crisis support, psychiatric urgent care, crisis residential units for both adults and kids, all of which will be opening in a phased approach throughout 2025, which we're going to talk more about in a little bit. But we're opening our doors January 5th, 2025. And the whole idea behind the center is that anyone, regardless of age or insurance, is going to be able to seek crisis care and connection to other services at the center.
And Michael, where is this located?
Yeah, so it's located on Munson's campus. The address is going to be 410 Brook Street. It's the old behavioral health building from Munson. It's been totally renovated. It's right by the hospice building.
And what will the staffing look like?
So this is a unique project. We're sharing staffing between Munson and Northern Lakes. And for Northern Lakes' portion, our staff will be folks like Risa and Hunter. So we're going to have certified peer support specialists, as well as bachelor's and master's level clinicians.
And Risa, what's the goal of the center for the community, and why is this needed?
The goal for the center is to provide a safe environment, a welcoming environment for those that come in and seek mental health services or behavior services. It's much needed because in the community, due to reducing lack of hospital visits and law enforcement contacts.
And Hunter, this next one's for you, and Michael had touched on this earlier, talking about that phased approach to providing services there. Can you describe the services that are going to be there and how the timing is planned for these phases?
Yeah, for sure. So like Mike said, we're going to go through phases, and it's going to be 4 different phases. So starting January 5th, so 2 weeks from Sunday is going to be our grand opening. And it's going to be limited hours. So we're going to be open from 8 a.m. to 8 p.m. Sunday through Thursday. And we're going to focus on in-person crisis services. So like Risa said too, we'll have, clinicians, peer support specialists that will work together to kind of de-escalate situations with clients, provide immediate support, and determine the best course of action for our clients. This might include, helping someone develop a safety plan, working on coping skills, possibly an evaluation for hospitalization if they need a higher level of care, but ultimately just offering a safe space to process their crisis. And we're also going to connect clients with other necessary services like potentially substance use treatment or ongoing mental health care like outpatient therapy. Phase 2 is going to be in July of 2025, and that's when we're going to expand to 24 hours, 7 days a week service. And we're going to introduce our living room model, which is kind of like a less clinical setting for support during a crisis. So clients can stay in that living room for up to 23 hours, and the goal is to create a plan to address their crisis within that time frame. But obviously, as soon as possible, ideally. And this phase will also include the launch of Munson Psychiatric Urgent Care. So that will provide immediate mental health care and access to medication management, which is super necessary, I think, for our community. And then phase 3 will be kind of later in the summer in 2025, TBD, but this will involve the introduction of an adult crisis residential unit, or CRU. It will have a total of 9 beds for short-term intensive care for individuals in crisis. A typical stay in a CRU is about 7 days, but could be more or less. And then finally, phase 4, which is planned for fall of 2025, will be the introduction of our pediatric CRU, which is going to offer specialized care for children and adolescents experiencing a mental health crisis.
Sounds like your team put in a lot of work, a lot of time to figure all this out.
Yeah, definitely.
Yeah, smiling, nodding their heads. So Hunter, I am curious to know why the phased approach?
Yeah, it's a good question. I think the phased approach really allows us to gradually increase our services, ensuring that we have the right staffing, resources, and infrastructure in place to provide the highest level of care for our consumers. It also gives us that flexibility to adapt and make improvements based on feedback that we receive in those opening phases.
And Risa, we'll go back to you. Who'll be able to go there? We'll start there with these services.
Well, anyone with a mental or behavior crisis will be able to attend the center. As far as what they'll be expecting, as far as when they come to the center, will be a welcoming staff. They'll be welcome in a safe environment. They'll be connected to access and linked to outpatient services if needed, and just pretty much provide an all-around quality care for the client while in crisis.
And once this opens up, how would a person know whether they should go to the new center versus maybe the emergency room?
Well, if they have a physical health issues, they're more likely to report to the ER. If they have like a concussion, anything where bodily fluids are coming out type things, they will report to the ER. But for like mental or behavioral health crisis, they report to the center so we can assist them to the best of our abilities.
Thank you for that, Risa. Good distinction. Hunter, back to you. Will you be working with people who have substance use issues?
Yeah, absolutely. So Northern Lakes, we're taking a holistic approach to our crisis services, and that includes supporting those with substance use disorders. While we're not a specialized substance use treatment center, we'll provide immediate crisis support and help connect individuals with appropriate resources for ongoing care, which could be addiction treatment services, 217 recovery, or our quick response team in our area for issues like substance use.
And then will you still be offering the mobile crisis services at Northern Lakes, Hunter?
Yes. Yep. Our services will remain the same. The center will just be in addition to everything. So we'll still offer our mobile support and have staff for that.
And then can someone still walk in during a crisis at Northern Lakes offices?
Yes. Yeah. We'll still be all staffed up at our Hall Street location for walk-in crisis as well.
And then, Risa, we want to know where those Northern Lakes offices are located. Again, we're based here in Northern Michigan for our online viewers, just to let everybody know.
Well, our 2C office is located on 105 Hall Street, across from the Beta Station. We have 4 offices, one in TC, Cadillac, Grayland, and Houghton Lake. We services 6 counties: Leelanau, Grand Traverse, Crawford, Wexford, Roscommon, Misaki. And these places you can attain mental health services in these locations.
And then what about contacting help in a crisis by phone, Risa?
Oh, you can contact the 24-hour crisis line. The number in which you can call will be 1-833-295-0616, or you can call the main line for the center, which is 231-213-1050.
Mm-hmm. And before we got started with this here, I was talking to everybody, and they were quite aware. Obviously, they're very involved with this project, but we had one of our reporters, Cody Bear, go to the center. This was last week during the open house. And so if our viewers want to go onto our website, upnorthlive.com, you can just search for Grand Traverse Mental Health Crisis and Access Center. You can find video, you can hear the interviews and things like that. You can also replay this once we're done here. But is there anything that anybody wants to add? Obviously, this is a big project, a lot of work going into this, and it sounds like it'll be a great benefit to the community. Does anybody want to add on to that?
I would just say I can't thank these guys enough, Risa and Hunter and the other peer support specialists and clinicians that we have coming aboard. They've been training at our Hall Street office, and they've been doing a phenomenal job. And, I would also like to thank Munson and the community partners for taking what is a project with a lot of moving pieces. And I think making some real progress on this. It's going to be a great benefit for the community. And for those out there, I would just say, if you don't know where to start and you're having a mental health crisis, give us a call or walk in, and we'll help to be that bridge to whatever the next step is for you.
Mm-hmm. Thank you, Michael. Risa or Hunter, anything to add on top of that?
Yeah, I just want to kind of piggyback and say, I think it's a really special opportunity to have this new center and partner with Munson. And, it's going to be a really great opportunity for staff, but also consumers and clients that we work with to have this center. And it's going to be a really great place for the community. So I'm just, again, really excited to be a part of it all.
Mm-hmm. And Risa, you get the last word.
Well, as far as me, I am looking forward to helping those in their journey through wellness.
Mm-hmm. Well, thank you so much, everybody for joining us here, and also our viewers here in the UpNorthLive Facebook, YouTube, and X pages. And we hope you have a great rest of your Wednesday. Thanks for your time today, everybody.
Same to you too.
Thank you so much.
Thanks.
Bye.